Hello, my name is Natalie Hanna. Today I am presenting the topic anemia. So, what is anemia? Anemia is a condition in which there is a decreased amount of erythrocytes to carry adequate oxygen to your tissues. When a person is anemic, their blood lacks healthy erythrocytes or hemoglobin. Here is a photo of a healthy erythrocyte. This photo shows the hemoglobin, which is a main part of the erythrocyte, and the oxygen that binds to it. If hemoglobin is abnormal or low, the cells in the body will not get enough oxygen. Therefore, organs will not get what they need in order to function properly. The main causes of anemia are blood loss, decreased or faulty red blood cell production, or destruction of red blood cells. In the next few slides, I will go into more detail of each of these. The causes of blood loss can be from many things. It can be caused by gastrointestinal conditions such as ulcers, hemorrhoids, gastritis, and even cancer. In women, menstruation and childbirth can be a cause. The photo on the top right is of an ulcer on the inside of a person's lip, and the bottom photo is an endoscopic view of gastritis. In the case of decreased or faulty red blood cell production, the body can produce too few blood cells, or the cells may not function properly. This can be due to abnormal red blood cells or a lack of minerals and vitamins needed for red blood cells to work properly. This cause can be associated with sickle cell anemia, vitamin and iron deficiency anemia, bone marrow and stem cell problems, or other health conditions. In the case of destruction of red blood cells, this is when red blood cells are fragile and cannot withstand the routine stress of the circulatory system. Many may rupture prematurely, and sometimes there is no known cause for this. The picture on this slide shows the rupturing of a red blood cell. Symptoms for the different types of anemia can be similar. Some may have distinct symptoms, especially with those that are more serious. Here is a general photo of symptoms associated with anemia. For now, I will leave this up for a little while so that you can see all the different things that could come from anemia. Some other symptoms associated with anemia can include frequent infections, headaches, cold hands and feet, inflammation or sores on the tongue, brittle nails, craving non-nutritional substances, restless leg syndrome, or even poor appetite. Here I have a couple of photos that I found. The top photo is of brittle nails due to anemia, and the bottom photo is a sore on the tongue that may be due to anemia. Complications usually occur in more serious cases of anemia. Some complications could include severe fatigue, which may make you too tired to complete everyday tasks, work, or play. You could also have heart problems, which could include arrhythmia, or the heart may have to pump more blood to compensate, which could lead to congestive heart failure. There's also losing a lot of blood quickly, which can result in acute severe anemia, and this could be fatal. It could lead to death. The first step in diagnosing anemia is to see a doctor if you have prolonged fatigue or other symptoms that may worry you. Some things that may happen at a doctor's office would be a physical exam, complete blood count, also known as a CBC, or they could take a test to determine the size and shape of the red blood cells. Based on what these tests bring in, it may lead to more tests to determine what exact type of anemia you may have. Treatment for anemia depends on the type of anemia one has. For instance, if you have iron deficiency anemia, you would be treated with a change of diet and iron supplements. If the main reason for this is blood loss, then the source must be found and stopped. Another is sickle cell anemia, which treatment can vary. Treatment could range from folic acid supplements and antibiotics to administering oxygen and pain-relieving drugs, and also could lead to blood transfusions or even bone marrow transplants. Here you see I have some photos of the types of treatments I just mentioned. There are many types of anemia that cannot be prevented. The two types that can are iron deficiency and vitamin deficiency anemia. This can be achieved by choosing a diet including a lot of vitamins and nutrients. Some vitamins and nutrients for you to think about are iron, folate, vitamin B12, and vitamin C. So next time that you're going shopping, try and remember these vitamins and nutrients to ensure that you do not become anemic. This concludes my presentation. Thank you.